Hello, everyone, and welcome to Power Hour. We're really thrilled to have Eileen Devine with us again today. Always a very popular presenter because she really gets to the heart of the things that matter to us as caregivers. And today's topic is has great interest. What about my other kids navigating the dynamics of sibling relationships in families of children with pediatric epilepsy? So I will let you take it away, Eileen. Thanks.
Wonderful. Thank you. Hi, everyone. I'm so happy to be back with you all and really happy to be talking about this topic. This is a topic that comes up all the time with the families that I support and is super tricky and deserves the time that's been set aside for it today to really dive into it. Before we get started, if you and I are crossing paths for the first time, I just want to let you know a little bit about who I am and what I do. I am a licensed clinical social worker. I live in Portland, Oregon. I work with parents all over the world and in a few different ways, all of them focused on helping them understand their child who lives with a brain-based difference and usually very challenging behavioral symptoms. So though that can look like a lot of different diagnoses, gets lots of different labels, but what all those parents have in common is that their child's brain works differently for some reason, and the parent is understanding through trial and error that what they do for their other kids just doesn't work for this child in terms of the way they support them and are in relationship with them. So the other half of that work, at least half of that work, is focused on the parent experience because, as you well know, so much of this um, depends on us having the endurance that is required to parent a child with such intense needs. So, how are they doing from a mental health, spiritual health, psychological health standpoint, and how can they become more resilient each day despite the really difficult circumstances that they're living in? And I say us because my lived experience as a parent is that I have two kids, and this is really relevant to our conversation today. My son Connell is 17, and he is what society would consider very neurotypical. My daughter Maya is almost 16, so they're 15 months apart, and she lives with a very serious and permanent brain-based difference that at times has challenging behavioral symptoms, if not challenging, baffling, confusing, relentless, that sort of thing, right? So her diagnosis is different than what you all share in common. Her diagnosis is fetal alcohol spectrum disorder. So she was prenatally exposed to substances, but it caused her brain to not be able to develop in the way we would expect. And so it's a permanent brain damage or a permanent brain difference that she lives with. So that's how I got into this work about a dozen years ago when I was finding myself very lost at how to parent her in ways that were in alignment with how her brain works and very, very differently than I parent my son. So I mentioned that dynamic because it will come up later today. I'll share a little bit about the relationship between Connell and Maya, but having two kids that are so close in age, yet worlds apart in terms of how they need to be parented, that's a tricky thing to navigate, right? When the sibling starts to recognize things and have their own feelings, understandably, and reactions to what's happening with their sibling. How do you support them in addition to the child that lives with the difference? So, okay. So I want you to, again, be mindful of questions that you might have. I have saved some time, if all goes according to plan, for us to have a discussion about these topics when we're done. All right, so today's focus, we're going to really try to dig into and tackle these questions. When you have a child that has such intense needs, where they need the constant supervision, the constant care, um, from you, or if you have a partner, from your partner, how do you balance this with the needs of your other children? How do you support your neurotypical children when they have experienced trauma due to living with their sibling, right? Traumas of meltdowns, of rage episodes, the frequent hospitalizations of their brother or sister. How do you support them through that? How do you help them understand their siblings' illness without creating a double standard or excuses, what looks like excuses for unacceptable behavior? How do you help them understand their sibling's illness without feeling as though you are creating a double standard or you're creating excuses? And how do you balance the needs of all of your children when one of them requires everything that you have to give? How do you strike that balance? Where do you even begin moving towards maybe more of a balance? So we will do our best to dive into all of those today. I want to begin with your resilience and what is required of you to do all of what we're going to talk about today, and start with self-compassion. And the reason why I start here is because a lot of parents that I work with um, are very harsh in their evaluation of how they're doing. There's a lot of room. There's always more room for more self-compassion. But we also know that self-compassion buffers against, it protects against, it's a protective factor against depression and anxiety. We have research that shows us that. And when you are living in what can feel like an impossible situation at times, looking for that elusive balance, trying to get it right, whatever that might mean to you all the time, feeling like you don't have enough to go around. Self-compassion is absolutely a necessity, right? So that you can, again, have the endurance that you need. I'm not suggesting that self-compassion is going to solve all of that, but it is a really worthwhile place to start. So as we go through this information, what I'm going to be asking you to do is to reflect on what you've done in your parenting of the sibling children and what you might do differently, because that's what we're here to talk about. And to do that in a way that has lots of self-compassion and grace associated with it, right? Because oftentimes it's our natural inclination is to hear that suggestion or what you might do differently and be really critical of how you've maybe done things in the past. That doesn't get us anywhere, right? So trying to keep self-compassion at the forefront as you reflect on this today. Before we dive into the sibling experience, I want to take a few minutes to step back and remind ourselves of what is actually happening with the child who has the epilepsy, who has the brain-based difference. And the reason for this is we need to have our lens firmly in place, that lens being looking at them through this brain first lens. How is their brain? How is this all connected to their unique neurobiology? Because when we go to support the sibling children, we have to have that lens in place so that we can help them see their brother or their sister through that lens. So helping them understand their brother or their sister, and the illness without creating the double standard, without creating what looks like excuses for unacceptable behavior, begins with us being really clear on why we're doing what we're doing. Why are we parenting this one child differently, maybe drastically differently than your other children? Okay. So we know that all behaviors are directly tied to our neurobiology, our kids' neurobiology. Um, it's not something that just happens with our kids. It's a part of all of us. So when we're talking about neurobiology, we're talking about the brain and how the brain works, and also the nervous system. So I want to walk through that just for a bit, high level overview, so that we can then jump into how to communicate that and weave that into the conversations with the sibling. Again, not to make excuses, just to create understanding as time goes on. So we know that all behavior lives inside the brain. The two cannot be separated. So anytime that we are considering a behavior, seeing a behavior, wondering why the heck is this happening again, we usually get laser focused on that and we go after that with all of our energy, all of our resources, because we just want it to stop, right? We're missing more than half of the equation if we don't consider the brain right alongside of it. What does this mean for my child's brain? I know their brain works differently. How does that impact what's happening right now and is connected to their behavior? The two can never be separated. Okay. So understanding that, of course, is paramount. And then also understanding their fragile nervous system. So our autonomic nervous system is what helps all of us stay in balance. It's what helps us kind of rise and fall with the stressors that come our way. When a child's brain has been impacted, they have a medical condition that is very seriously and has not just impacted their brain, but probably other parts of their body too. You can assume that they live with a very fragile nervous system. Now, we'll talk about what that looks like, but what I do want to also just put out there for your consideration is many of the parents that I work with over time have described their nervous system becoming more fragile in nature as well. And it makes sense to me given the chronic stress and sometimes the trauma that they've experienced. Now, the siblings in your family, they may also have a fragile nervous system because of the chronic stress that they've experienced in their home because of the complexities of their brother or sister. Okay, so this again, lots of self-compassion as you hear this and reflect on your own experience. What that means then is that small amounts of stress, it's like an accelerator. It impacts brain function. That's not necessarily bad in the short term. It's what can motivate us and get us moving when we need to. It rattles our nervous system, right? We get dysregulated. When our nervous system is fragile, it's really hard for us to recover from that. So small amounts of stress have big reactions. My guess is you can remember very quickly times where this has happened with your child who has epilepsy. But maybe you can also identify how that's changed for you over time. Your window of tolerance, maybe for stressors, has narrowed over time. It also may be the case for the sibling children in your family, right? That over time you've seen them have a smaller window of tolerance where they have more frequent meltdowns, where small frustrations cause big reactions, where their ability to be reasonable is diminished, right? It's like having an accelerator, that stress, with no brake to kind of help balance that out, right? What that means is that we need to make sure our brake is working really well, building our resilience, getting support. We'll talk a little bit about how to do that so that you can show up for your kids, both both the sibling and the child with epilepsy, in the way they require if their brake isn't working as well, right? They need to borrow from your brake to be able to do that. Again, that's why I want to go over this first so that you can see how the parent experience is integral, of course, to supporting the siblings and also the child with epilepsy, but really concretely how this all plays out. So fragile nervous systems, that stress has a more exaggerated accelerator response with this impaired ability to brake or self-soothe or calm. Okay, so again, thinking about how this, maybe you've noticed this more frequently over time with your sibling children. There's a reason why. That's what chronic stress does. The goal is not to never get dysregulated. That's an impossible goal. The goal is to notice when we are getting dysregulated and do what we need to do to get back into that regulated, more balanced state, right? When we're thinking about this role as a parent and how to help the siblings, the goal is to notice when our child has slipped into dysregulation because of their fragility and to support them in getting to a regulated place again. That's co-regulation, being with them, right? We'll talk a little bit more about that concretely, what it looks like. And again, it applies to all your kids, but we'll talk about it with the siblings since that's the focus for today. All right, so this foundational understanding, again, getting our lens set really firmly because all of that matters in terms of how we support the siblings in our family. If a brain-based difference or illness is a physical condition with behavioral symptoms, what does this mean for the way we support children with brain-based conditions? We provide them with accommodations. This is where that making excuses for behavior or letting a child get away with something that the siblings are saying, hey, that's a double standard. What's going on? This is where this piece really matters. Okay. So accommodations are not giving in. They're not giving up. They are the result of you as the parent understanding, being really clear on what it means for your child to have a brain that works differently and a fragile nervous system, and adjusting your parenting of them based on that so that it's more in alignment with their unique neurobiology. So it is what's right, it's what's just, it's what's fair, it's what we would do for any other child with, say, a more visible physical disability. But it's also the path to less challenging behaviors because those behaviors are the symptoms, the indication that our child is in distress, that they are overwhelmed, that they need more support, right? So again, we're talking about this for two different reasons. One is to understand why we're doing what we're doing with the child who has the brain-based difference so that we can translate that and talk about that, explain that to the siblings, but also to understand that even a neurotypical child who's under chronic stress, for example, maybe something is difficult for them that on a good day wouldn't be difficult. When we notice that they're having that hard time, is our inclination to say, ah, oh, that's them in distress and overwhelmed, and I need to support more, not say, you can do it. Come on, you just got to deal with it. You're a big girl, let's go. Right? So again, lots of self-compassion as I kind of question these two lenses, because it's a really very normal experience to find yourself in both at different times, right? Depending on your own resiliency, your own level of stress, all of that. So accommodations can be very concrete in nature, like giving more time. You give, responsibility in the home looks very different based on their skill level, all that kind of stuff. But it also includes shifts that we make within us and in how we react to a certain situation or behavior. So for example, if you have a child who is of an older age and they're having, a meltdown, what we would think of as a meltdown, but at this older age, maybe it includes just a verbal assault on you that is really hurtful, really disrespectful. The accommodation may be that you in that moment know that you can't address it head on, that if you get more rigid and try to exert your control and your power over that teenager having a meltdown, that it's going to get worse. And you know that because they are really fragile in terms of their nervous system. And so you make the choice and the decision to not do that. You don't address that verbal assault on you in that moment. You take another path of trying to co-regulate and get them to settle back in so that you can maybe then address the behavior later. It doesn't mean we don't ever address the behavior. It means we do it really differently than we would do with our neurotypical kids. Okay. When we think of cognitive skills and where do we make accommodations, where do we have a different understanding of our child who lags behind in the cognitive skills, how is that then reflected in the way that you parent them differently than the sibling kids? And being really clear on why you're doing that, right? Um, I want to make sure that we're also including cognitive skills that are required to be in a reciprocal relationship with another person. These cognitive skills are the same as executive functioning or learning and memory, processing pace, things that we typically think about our brain doing for us, but they often get missed because they feel really personal. So things like emotional and social skills, a child being half their age, for example, in terms of their interests, in the terms of the way they act, like acting very immaturely, right? Doing something that's really embarrassing or inappropriate behaviorally, not knowing how to interact with their peers in socially appropriate ways, all of that kind of stuff. Cognitive flexibility is another one. So being able to go with the flow, being able to say, oh, this is what the whole family wants to do. Sure, it's not my first choice, but okay, we can do that, right? Or this is the movie everybody else wants to watch. Sure, okay, that's fine, right? Um, Being able to see the gray in situations, not to be just super, super rigid in the way that you think about things and the way that you react, being able to let go in an argument, right? Being able to transition out of behavioral loops and verbal loops. All of that, the inability to do those things is a cognitive skill set that when a child does not have those skills, it makes it super difficult to be in relationship with them. Now, again, the reason I'm highlighting this is because my guess is this is what really gets in the way of their sibling relationship. That their sibling, who maybe is quite a bit younger than them, is saying, what the heck? Like, why do we always have to do it their way? Why do they insist on, doing this every time? They're so selfish. They don't think about anybody else, right? The last one, these cognitive skills, is emotional regulation. So being able to tolerate frustration, being able to tolerate the need to wait, right? It includes being able to take somebody else's perspective into consideration, put yourself in someone else's shoes, connect the dots and see that, yeah, your words and your actions really impact those around you. That is really easy to see as character flaws. And oftentimes, when we don't have our lens firmly in place about what's happening there, it can't be translated to the sibling. So the sibling, understandably feeling really hurtful, maybe really resentful, because their brother or sister can't ever be flexible, can't ever go with the flow, can't ever put their needs kind of secondary, right? And the sibling saying they're just mean, right? That's about their character. They wouldn't use that language probably. For us to be able to help them understand this is part of their brain-based difference. And man, yes, it's hard, right? But that is what it is. So really having that balance, and we'll talk more about those conversations in a moment here. So what all of that is, in a nutshell, is really talking about those behaviors that I know can be incredibly stressful on the whole family, can cause a lot of chaos in the family and in the home, can take a lot of your time and energy. Being able to see them for what they are. And not that that makes then everything okay, but it is a starting point to helping the siblings understand what's really happening here. So behavioral lens is behavior is willful, it's intentional, it's manipulative. They just don't want to do it, right? And they're doing it to me on purpose. Looking at your child through the lens of their unique neurobiology, the brain first lens is, okay, they have a brain that works differently. They would be doing better if they could. They navigate the world really differently than I ever imagined because of their brain-based differences. There's some seemingly easy expectations or tasks that they can't meet or complete because their brain works so differently. And keeping that lens firmly in place, right? Understanding where that behavior, it's a symptom of something else. And then how do you address that? Okay, I'm going to take a quick walk. I've learned if I don't take my sips of water, then I start coughing. My throat gets dry. Okay, so all of that is really to set us up so that we can remind ourselves. And some of this might have been new to you. It might be a new perspective. For some of you, it might be a review. For some of you, it might be like, oh, yeah, I know that. But in my day to day, that's not the way I respond, right? Again, lots of self compassion, because if it was easy to hear it and then just to put it immediately into work, I probably wouldn't have a job. Right? It's so hard. It's so hard. So reminding ourselves why we do what we do and what we know to be true about our kids so that we can stand confidently and firmly in that as we also support the siblings, right? It's not making excuses, it's helping them connect the dots, just like somebody's had to help us connect the dots probably at different points in our life. Okay. So now I want to talk about what we know about the sibling experience. Um, Siblings who have brothers or sisters with complex medical needs, behavioral needs, what that might look like. Where I always want to begin is with trauma. Um, Many of the parents that I've worked with in their home, things have been really, really hard. And the siblings have experienced trauma as a result of their brother or sister. That is devastating for those parents to really look at and come to terms with, but it's so essential because trauma has lots of impacts that need to be addressed, and it can also be something that people heal from. Okay. So, trauma, events that exceed our capacity to cope and cause a disruption in emotional functioning, they aren't necessarily life-threatening, but rather cause people to feel helpless in their circumstances. Okay, so again, as we're talking about this, I want you just to think about the siblings in your family and what pieces of this might be their experience. So oftentimes we think about trauma as the large traumas. You might have heard like um, capital T traumas, large traumas, or small traumas. Large traumas are extraordinary, significant events that leaves us feeling powerless, possessing little control in our environment. Okay. Small traumas, they're not small in significance. It doesn't mean they are less impactful. They're just events that happen repeatedly, maybe daily, that exceed our capacity to cope and cause a disruption in our emotional functioning. So they're not necessarily life-threatening, but they do result in this pervasive sense of helplessness and maybe hopelessness. How someone responds to trauma is personal and individualized. So strong support systems matter. Some individuals who have histories of trauma have a harder time recovering than, for example, someone who has little to no traumatic experiences in their history. The duration and the intensity can look different based on those factors, the support, the history of trauma. If the individual, the sibling in this experience, but honestly, in your experience too as a parent, if you have many resilient qualities, that impact is going to be not as intense, right? The duration will be shorter. I say that because your history matters. Again, as parents, we don't come into it as parenthood as blank slates. So if you experienced, for example, childhood trauma, oftentimes that is re-triggered in your parent experience and really makes it difficult to show up in this regulated way, right? With your break, like we talked about, um, to be there in that space for your child. If you have a child, a sibling who has had multiple traumas, small traumas or big traumas, and that matters too in terms of the amount of support they need to be able to recover from this experience. There can be a hypervigilance, which is being on edge and knowing you're on edge, and there's not really anything to be on edge about, but you can't calm your body down, right? It's not a condition, but it is a way of behaving that is a direct result in many cases to trauma. So having this awareness that I'm on edge, but you can't relax, you can't settle, right? Being on guard in anticipation of something bad happening in the future. So I want you to just have some of this awareness so that you can reflect again on the siblings in your family. Does this apply to them? Does this resonate what you've seen in their behavior, the way that they've kind of navigated um, the home and the relationship with their brother or sister? Okay. So, more on the sibling experience. It closely mirrors the parent experience. We know this based on research that our attitude towards our child who struggles will trickle down to the siblings. That's why we did all of this reviewing about what actually is happening with that child. Why are things so challenging with them? If we lead with empathy, they will learn to do this as best they can. Okay. If we treat our child who struggles as having an illness, a brain-based difference, a medical complexity where accommodations have to be in place, um, versus the child who's always, a burden, intentionally ruining everything, the sibling will follow you down one of those paths. Okay. And so we're not going to always get it right. We reach our limits and sometimes we don't show up in the way that we would like to, like, again, being void of empathy, for example, in that moment. That is going to happen. It's what is the pervasive pattern in your home, the way you talk about the child who struggles, the way you respond to them. A pervasive sense of confusion. So, for example, a child who is struggling and they're throwing things, and maybe they even broke something by doing that. And your sibling child doesn't see any consequences happening in the moment because that's the accommodation and the shift. You know, it's a waste of your precious energy to do that. And so there's no consequences that are visible to them in the moment. And the next thing they know, you're all sitting down to eat ice cream together, right? But there's no discussion about that. They don't have any lens for that or understanding of that. They don't know what's going to happen maybe later to address what happened. So they view there being this double standard, which is confusing, right? It's difficult. It's difficult for even adults to understand, let alone kids. So conflicting feelings. This can look like the guilt that they have feelings of hate and resentment for their sibling or for their brother or sister for something that their brother or sister can't control. Guilt that they are healthy when their sibling is not. Feeling shame, but also feeling sympathy, feeling resentment towards them, but feeling guilty about that because they know it's not their fault that they have this illness, feeling guilty that they should be able to do more about it, right? Not wanting to burden you as the parent. Maybe there's perfectionism. Maybe they keep their personal worries to themselves. It's like, oh, we don't have to worry about them because they're just fine. When maybe it's just more of a shutting down. They don't want to burden you with what's happening with them. Being fiercely, this vacillating between overprotective and avoidant, being fiercely protective of their brother or sister that struggles in some cases, but also experiencing victimization, right, at the hands of their brother or sister. And then parentification, trying to control the environment by taking on a parental role, usually showing more independence, more resourcefulness than peers out of necessity, which can be really bittersweet as a parent to experience. So really reflecting on, are there ways that a, an under a pattern, I guess, has been created in your family where they're required to take care of their sibling, their brother or sister that struggles in ways that maybe aren't appropriate for their age, right? Are they required to take care of your emotional well-being? It's really, really hard to reflect on that because none of us would do that intentionally, right? But is that, now that you can take a step back and reflect, is that part of the pattern that you're seeing? All right. I want to move into when these things are at play, how can you support the siblings, the brothers and sisters in your family? We're going to start with physical safety, and then I want to move into emotional safety. So, um, if you don't have a safety plan and you have a child who has escalated behavior, certainly aggressive behaviors, destructive behaviors, scary behaviors, but I would say even just escalated behaviors that cause a lot of disruption, stress in the home, I would encourage you to have a safety plan. And what it does is it reduces your cognitive load in that very stressful moment. It's hard to think and be planful and make decisions when that's happening. They relieve stress for you, for other family members like the siblings, but they need to be accessible. They need to be thorough. They need to be clear. Okay. So the basics of a safety plan is, what do you do? If you are in a two-parent household, what does the other parent do so that you're not kind of working against each other unintentionally, right? Divide and conquer. Is one parent going to attend to the child who's struggling and the others are fully focused on the siblings, for example? What do the other kids do? So this is if you have a child who kind of rushes in, wants to help take care of the child who's struggling and soothe them, or maybe they're standing by because they don't know if they need to help you, right? This relieves them of that pressure. Then they have a role and they know exactly what they're supposed to do. And in that, for example, if it's going to their room and you've set up a space, they know that's their space. Do they have headphones? Do they have, you know, their iPad close by, for example? Is everything there set ready for them to follow that plan? And how do they know when it's time, when that plan is being enacted? And then who will you call and what is their role? So, for example, you have a really great neighbor that's become like a family member that lives next door, and you tell them that, hey, do you mind being a part of my safety plan? This is what I would hope that you would do. And you get very specific with them when you come to the door. I don't want you to knock. I want you to walk in. And I don't want you to come find me. I want you to go and sit in that chair in the living room. I don't want you to say anything, right? I just want you to be a presence unless I ask you to do something differently. Get real clear with them so they're not coming in trying to take control and making things worse unintentionally, right? And then what are you going to say and not say in those moments? And the reason I mention this is because oftentimes our stress will get the best of us and we'll start talking too much, we're talking louder, we're trying to reason, we're trying to negotiate, we're trying to be logical with our child who's struggling when none of that is possible for them in that moment, right? So this allows you to remind yourself of, what am I going to do and not do? Am I going to offer food and drink to them? Am I going to say less? Am I going to not talk at all? Am I going to get low in posture, my body posture, whatever it might be? Okay. So what do your other kids do? You want to talk to them ahead of time. You want to rehearse. You want to have it set up. Again, the snacks, headphones, whatever it might be, and let go of any of those expectations that you might have related to those things, right? Like no snacks before dinner. Oh, this is happening before dinner. That expectation is no longer in place. All right. Of all of the different feelings that we think about with the sibling experience, grief is I think is universally present, and acknowledging it can be so healing and freeing to the siblings. But what that means is that you need to um, really feel like you are steady in terms of your work that you've done to address any grief that is present for you in your parenting experience, right? That's one thing in and of itself. But to have a sibling coming to us with their own grief, related to their brother or sister. Like, we don't want to crumble underneath the weight of that. So being sure that you're getting your own support, working through your own emotional experience so that you can attune to your child, the sibling, when they come to you with really hard things, right? So grief being described in three different ways of, and I want you to think about the siblings, what their experience of this might be, the loss of what will never be, longing for what may never be, and feeling lost, right? Attempting to reorient yourself to your reality and your situation. It's also disenfranchised, right? Which means it's not recognized by others. Nobody's coming to join you in your mourning. They may not even recognize that that's happening. We heal in connection with others. That is usually not there, right? In this particular kind of grief. So acknowledging it yourself, attending to your own grief, so that you can then help your sibling child through their own grief. So, four questions that I would encourage you to ask yourself when you're supporting your child through grief in the family context. Do all of your children know that it's okay to talk about feelings? And how do you know that they know? What's your evidence, right? Do they know it's okay to talk about hard feelings or uncomfortable feelings, and that you will be open to receiving that from them, that you can attune to them? Nothing is too hard for you to hear and to hold and to handle when they come to you with it. Do they know it's okay to talk about grief? Have you ever named it, right? Do they know it's okay to talk about grief that's specific to being in a family that has a brother or sister with complex needs and is sometimes really hard to live with? So when I'm working with families, we're looking at creating a culture in a family in which the kids can feel as though the grief is an emotion that they can tolerate and be with, right? We're not trying to erase it. That's an impossible task. It's, can we help them tolerate it and be with it to move through it, right? So those are the things that I'm looking for. Um, and the questions that I think asking yourself might help you identify if that's possible. Okay. I wanted to highlight trauma on its own. I wanted to highlight grief on its own. These are some other ways that you can think about supporting the siblings in your family. So we talked about trauma, recognize the intensity and the severity of their experience if it has indeed been traumatic. What support can be done to help them move through that, right? Validating their feelings, giving permission to voice their true feelings and true concerns. Attunement and validation. It means that we are being with them in that feeling. Again, so that means if you feel very fragile yourself, which would be completely understandable, it's going to be really hard to be with your sibling in the hard things they bring to you, right? So getting your own support so that you can do that for them. Do they feel really seen in their experience as a sibling of a child with the intensity of needs that their brother or sister has? Do they believe that you understand how hard things are for them, how bad things are for them at times, and how scared they may have been at different times? And again, what's your evidence? And I say that because oftentimes we're like, oh, yeah, they know that. But have you ever really talked about it, right? Has it been explicitly stated? It's really easy for their true feelings and concerns for them to feel that they're overlooked, that they're disregarded, um, that, for example, the pressure of being a child who doesn't have the intense needs, what that looks like, or the embarrassment they may feel at times of having a sibling who acts in the way that they do, whatever it may be that applies to your specific family. Does your child feel really seen and heard and known and understood when it comes to that experience? So, relatedly, without knowing it, sometimes we can project our own adult coping skills onto our kids, which means we often skip over the validation part. We don't sit with that for some time. We don't attune, right? We move right into the coping skills part. Oftentimes it's because of our own inability to sit with it, right? Maybe we're just missing it, but oftentimes it's our own anxiety, right? Well, let's just get to how to fix it or how to be better. And we end up communicating to our kids, you just need to get past it. You just need to get over it. This is just how things are. It's not their fault. Let's just deal with it, right? So we skip over the attunement and the validation, even when that's not our true intent. Um, and instead of saying, you're right, oh, I totally get that. This is so hard. It is unfair, right? It feels really crummy. I know it does. So letting them know that their experience is important, that what they have to say means something. Um, for example, I had a parent once who was talking about this exact situation of needing to attune to their sibling child. Their brother or sister was in the hospital. It was more mental health and behavioral in nature. And the sibling said, I hope my brother never comes home from the hospital. I like it so much more when they're not here. I hope they never come home. And the mom was just like, oh, right, just sitting with that and said, I understand. I understand why you would feel that way. It's okay to feel that way. And she just let that be, right? When really her reaction, her visceral reaction was to convince her child that that wasn't true, right? That they didn't really think that. They didn't really believe that because it's so heartbreaking. Okay. We've talked a lot about how to shift our lens so that we can help shift the siblings' lens, validate and attune. And then after that, move into, I totally get it. It is hard. It is under what I know to be true about your sibling, your brother or sister is they would be doing better if they could. Part of their disability means this. Their brain working differently means that, right? And I know it's still so hard. It's still so hard. Helping them connect the dots between the behavior and what you're doing and how their brother or sister is behaving. So, do they have some way of labeling, identifying, articulating, talking about behavior in a way that is curious, non-judgmental, um, and still honest, right? That's the balance, right? That's the balance. Do your sibling children truly understand what it means for the brain to have been impacted and what that means for this particular disability, but also their brother or sister? Do they understand what it means to have a vulnerable nervous system in the way that we've talked about it, right? The brake, the accelerator that's always, or the, sorry, the accelerator that's always on, the brake that's not working well. It's narrow window of tolerance, really seemingly insignificant things causing big reactions. Like what that's about, not trying to excuse it away, trying to provide context, right? And a sensitized stress response system, an overactive stress response system. Seeking out professional support for the processing and developing of coping skills is needed. This would also be such a huge support to all of you. So you're not in this alone, right? You have others who are providing the context and the support. And then looking for those patterns that I described, the love, hate, shame, embarrassment, wanting to keep their siblings safe, but also resenting that they're there to keep them safe. Say in a situation where you're not present, the parentification. Um, just being on the lookout for those. And again, lots of self-compassion, understanding um, that this all is as hard as you think it is. And that also, it doesn't mean that your sibling can't have an experience where they over time grow in their understanding of their brother or sister in ways that feel better to them, right? Um, don't feel so hard or traumatic or whatever it might have been the experience up until now. Okay, this is the last piece, and then we'll dive into some questions if there are any. I've talked repeatedly about the parent experience, how important it is. That's why I only work with parents um, and helping them be more resilient, shift their lens, that sort of thing. Um, I can't underestimate this. I know that you don't have more than moments a day, if that. That is the case for all the parents that I work with. And so when we talk about caring for your nervous system and building your resilience, we're talking about moments a day. That's where you begin. And understanding that that does matter, right? So that you can do all of the hard things that we've just talked about for the last hour. So lots of self-compassion, finding your community of people who can truly see you and hear you and attune to you, validate your experience, right? And who are also focused on helping you get to a better place. We don't want the compassion fatigue, the burnout to be a contagious thing, right? They want to help you get to a better place. Finding your own support, whatever that might be, and then building your resilience each day, right? Trying to move your body daily, even moments a day, right? Um, Doing the things that we know really cause our nervous system to be more steady in the face of some really hard and challenging situations. Okay, here is my website if you want to know more information about what I do, or I have lots of blog posts that are on there that parents find helpful looking through. And I also have a podcast that's just launching next Monday, November 11th. So you can find that by searching for my name next Monday. So hopefully, what I hope through the blog posts and the podcast is an added layer of support for you as you work to do all these really hard things that I've um, talked about for the last hour now. So, okay, Audrey,
Excellent.
you have
I know you didn't
questions?
hear me because I muted myself, but I kept saying, yes, yes, it is really that hard. Yes, thank you
Yeah,
so much. This was really great.
yeah.
There are a couple questions in the chat, so I'm going to try
Okay.
to translate them. One parent says she has a son with ADHD and a daughter who
Hmm,
had a hemispherectomy. The
hmm,
10-year-old son with ADHD is really struggling. He thinks ADHD is the same as as her daughter's
hmm,
deficits, and they
hmm,
deal with a lot of anxiety and competitiveness with him. Any
hmm.
advice on dealing with a non-neurotypical sibling
Yeah,
who has a younger sibling who had brain surgery and ongoing medical challenges?
yeah,
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 I think that's a really
yeah.
good question because we don't all have typical siblings. Sometimes we have two or three or
Yes.
four kids that all have unique challenges.
Yes, yes.
So, yeah.
Yeah, I mean, the same ideas apply here. What I mean by that is validating his experience, whether you agree with his logic or not, it is his experience,
Hmm.
and attuning to that. What is he trying to tell you by saying, "Hey, I'm the same." Like my needs are as great, or I need as much whatever, fill in the blank, as, sibling, as the brother, or I think it was a sister, gets. And being curious about that, right? Not
Hmm.
trying to push against what his reality is. And then there is some truth, right? ADHD is a brain-based difference. It points back to the brain. Maybe not as severe, maybe not as intense. I don't know that for sure. But there are some differences with him that
Hmm.
need over accommodating than what you would do for a 10-year-old, that need more. He probably has an overactive accelerator with a brake
Hmm.
that's not working. The same concepts apply, right? And so being able to validate his experience and know that he's communicating, I would imagine, hey, I'm having a hard time and I
Yeah.
need this too.
And you may
Um,
have already mentioned this, or you may have said it in previous talks because I've heard you speak so many times, but I think you once said something about asking the sibling what it is that they want. And sometimes it's very small. Like, I just want to have 15 minutes with you every Sunday before my soccer game, or I just
yes,
want to have one night a week where we sit on the couch and watch TV. And they will
yes,
feel like, so it's, I think sometimes we feel like we have to do equal. And
yes,
our kids are smart and they recognize when someone needs more in some cases. And
yeah,
sometimes you can just ask and they will tell you something that's actually not that big of a lift.
yes,
So it's possible, since the older child is older, if you acknowledge the struggles and then offer, well, what do you want to help feel more seen and validated, and
yes.
so.
Yes, that brings to mind another piece that I didn't mention, but if you are fortunate enough to be in a two-parent household, to really spend some time thoughtfully considering, how you divide and conquer with that
Mm,
attention, not just in the big moments. I feel like some parents are like, we've got that covered. Like we have our dates, we go out, we make sure but in the smaller moments, like for example, in my home, when my daughter was younger, dinner time was impossible because of her lagging skills. It was a very stressful um, ordeal for her. And so my husband and I were like, we've got to get this under control.
mm,
One of us is going to be assigned to her every alternating dinner. We tried
mm,
that. And the other one does not attend to her, right? That is no longer our focus. Our focus is our son. So
mm.
what happened in his day, the stories he wants to tell, that we're continuously being overridden and ignored by her behavioral needs,
Yeah.
right?
Yeah.
So that even just those like daily things that that divide and conquer, so that the other sibling feels like, okay, I have this time too.
Hmm. A couple more questions.
Okay.
One is about, do you notice any trends in birth order or age gaps? So for instance, if the firstborn is neurotypical, if the firstborn neurotypical child is 6 years older, or if the affective child is older, and then when siblings are closer together, do you notice any trends? Better, worse?
No,
No.
no, I really don't, because I think no matter what, the child who struggles impacts the child, no matter the age difference or the
Yeah.
age. An older child maybe has more maturity to understand the situation for what it is, but it's still going to be really hard for them. What I
Yeah.
do see sometimes is younger kids saying, they're older than me. Like, why aren't they doing, like, taking on more responsibility? Or why are they misbehaving? They should know better because I'm older, right? The
Hmm.
the younger child starts to surpass the child who struggles in maturity and skill level, whatever it might be. That's a conversation to have. Like
Hmm.
this is why that's happening, right?
Hmm.
When Connell, my son, I remember he was in kindergarten and he was getting very frustrated. I remember where we were when we first had that conversation about this is how Maya's brain works differently.
Yeah.
And in a kindergarten way. And it was repeated conversation over and over and over again, right? Where he, after that repeated conversation, lots of support, that fair does not mean equal. Like we talk a lot about that in our house too. Fair does
Hmm.
not mean equal. He's
Yeah.
like, I get it, right? But it took time. It didn't change overnight, right? It's
Hmm.
lots and lots of conversations with examples and all that kind of stuff.
Yeah. There is another question, and I think I'm going to answer it first, if that's
Okay,
okay, and then let you
sure.
respond. But so it's the question is, my 6-year-old has experienced watching traumatic seizures of her sibling and then
Mm,
being taken in an ambulance over a dozen times. They're only 2 years apart. I believe she's more calm when she can participate, but family has tried pushing to separate her in the moment, and it has resulted in her hiding from those family members and lashing out at them. And there's a second part to the question, which I'll come back to. So I would like to respond to this because we ran a pilot program in the Pediatric Epilepsy Surgery Alliance for 2 years, which was a monthly support group for teen siblings who had epilepsy surgery and had chronic epilepsy. And the number one message I heard was, we know something is happening and we're tired of being left out of it or being told that it's not, we don't need to deal with that, or we're going to hide this from you, or pretending it's not happening. And 6 is pretty young, but my guess is, and you're the therapist, Eileen, so I'm going to let you comment here, but my guess is that that response, her lashing out, is saying she's communicating, right? Her behavior is communicating something that is possibly saying, I want to be there when these things happen because I want to see my sibling when they're struggling and I want to be there for that. Now, I know there's like emotional capability at the age and
yeah.
whatnot. And then I'm going to ask the second part of the question. I'll let you answer both. How do I tell my 6-year-old her sibling's going to have brain surgery when they seem okay lately? And this is a big question, and we could probably do a whole power hour on
Ooh,
this topic in the new year. So we might not get to all of that, but give us a quick response because I know we're already a little bit over time. Uh,
yeah.
yeah.
The first part, I think that if your 6-year-old is able to communicate to you why they're doing what they're doing, they may not be able to, but if you can have age-appropriate conversations with them about when this happens, the seizure, the ambulance, I noticed you do this. I noticed
Hmm.
you get upset with this. Like, why is that? Can you tell? Because some kids, you want to make sure it's not that they feel this responsibility, like I have to take charge and do that, that parentification. That and And if they
Hmm.
do feel that way, then addressing that, right? The other piece is the safety planning piece. Do they know an alternative plan?
Hmm.
And have you rehearsed that? And have you talked about it? Have they had input into it? This is what I want to
Yeah.
do.
Yeah.
So making sure that you have that plan too. Um, the other piece about the discussion about an upcoming surgery, again, age appropriateness matters.
Hmm.
I don't know if you have any resources, Audrey, in terms of informational stuff for kids to explain that. You may not, or some other resource.
There was a young girl in our community who, I think she herself had uh, epilepsy surgery, and she did a little animated video. It's on our YouTube
Hmm.
channel. That you want to watch it first and make sure, but it's a computer generated, I think she hand drew part of it, and then, but that's nice because it's animated. I know there are some books about epilepsy. Um, it's a really good question. I think this is clear need for a resource that maybe is a
Yeah,
little better.
yeah.
We also had at our conference this summer, we had Courageous Parents Network come and present.
Hmm.
And the presenter did that I watched was talked about shared decision making and how, as partners in a marriage or the co-parenting or whatever it is, how do you recognize what one person's role is or approach or how they respond to questions versus another? I thought that was really powerful. And my guess is they have some resources for siblings and other family members as well. So I'll dig those up and include
Great.
in the resources I send and follow up.
Yeah. Yeah. I
Yeah.
think at the very least, you will not go wrong with giving it the time it deserves, bite-sized
Hmm.
conversations,
Hmm.
being really concrete, maybe even visual, like this is what's going to happen, and then this is what's going to happen, and this is what's going to happen, so they can anticipate it, imagine it clearly, and then giving lots of space for them to express their
Hmm.
concerns and their
Hmm.
fears, right?
Yeah. Well, this was really wonderful. I just put in the chat our survey, if everyone could fill that out, even if you're watching it later on YouTube, we want to know what you think. And then our YouTube channel is there. And if I'll put my email in the chat too, and Eileen gave you hers, but if you have further questions, you can just email me as well. And, things like additional resources, I always like to know what it is that we need. So thank you again for your time. I'm going to hit stop record here.